Mr. President has expressed great concern over the declining security situation in the country. He is extremely unhappy about what is happening, and he feels that even though the security agencies are doing their best is not good enough for him.
Yeah, your best, not good enough. Straight to the point from Mr. President to the service chiefs, and many did expect, okay, what's the next chapter? What happens thereafter? So there you go, and then that is that situation there. So who knows how that will play out? Looks, there are many permutations actually concerning what is going on. But then we'll see about that in a moment. Good morning, everyone. Welcome to Sunrise Daily today. I'm Chamberlain Uso.
I'm Kairi Okikele.
Welcome to the show. I'm Ayo Makinde.
And I'm Maokwe Ogun Yusuf. Good morning from Abuja.
Well, yes, much as the president had told them their best is not good enough, they need to do far much more. But given the amount of lives that have been lost and how the country is grappling with this, there are those who just wonder, should they still be on their seats, the service chiefs? Or will this be the very last warning or the very last meeting with the service chiefs before any further action? Who knows? I guess time will tell. But speaking about which, this is something that it continues to raise a lot of concern. The numbers of COVID-19 infections, look at this, 745 new cases. That brings the total number to 18,480, out of which 6,307 patients have been discharged and 475 dead. Well, yes, again, of these 745 cases, Lagos is recording the highest figure with 280 infections, and then it goes on with 103 in Oyo, 72 in Ebonyi, 60 in FCT, 46 in Imo, 34 in Edo, 33 in Delta, 25 in Rivers, 23 in Kaduna. It goes on. But there's a bigger challenge with this, and the huge question now will be, with this progression, having looked at it from how it keeps increasing, and don't forget, we've not peaked yet. So many challenges for the health sector, for us all. And remember, the interstate lockdown is still very much effective, at least from what everyone is saying. Yes, there's some movement, but the NOA speaking yesterday was just highlighting, almost complaining that we seem to have dropped the ball. We don't seem to care that much anymore as we used to. And it's not made any better when you see images of people who, perhaps asymptomatic, just resisting to get themselves to hospitals when they've been tested. So it's a whole bag. And how we need to do something much more than we're doing now if we don't want to see the health sector overwhelmed. I mean, we can't forget the fact that doctors are still on strike. Oh, boy.
You know, that was the thinking earlier on, saying we'd try to flatten the curve such that we don't overwhelm our health system. But the issue with flattening the curve is it makes this stay with us for longer. So instead of going up and coming down in just a few weeks, you flatten it such that it now stays with us. I mean, this is our 4th month already. And just to put this in perspective, Nigeria is currently 50th in the world when it comes to COVID-19 cases, 3rd in Africa. Now, at some point, we were just within, top 10 or 11th in Africa, and in the world we're over like 100 and something position. But right now we're 50th, and that's ahead of Japan. We're ahead of Ghana right now. Recall that at some point we were tied with Ghana and used to be almost the same position, but we're ahead of Ghana. Basically the same timeline, but it seems that at this point we are recording more cases. So yes, we may have flattened the curve, but it's tricky because it's still peaking at this point. Some countries have reached their peak and they're trying to dip right now and all that. But for Nigeria, we have not even reached that peak yet. And when you take a look at the progression from the very first week, you see where we are right now. To be fair enough, I mean, there was a lockdown and we expected that this will curb things, in quote, but see where we are right now, right after the lockdown has been eased. We seem to be spiking, as the case may be. So on one hand, we try to flatten it, but here we are right now. It's still with us for very much longer. And I recall the SGF talking about the biggest challenge to this is change, people changing their attitude. And just to give you a picture of how some people think about this, you can just go to the NCDC's Twitter handle. Each time they post anything about COVID-19 cases, see the responses you get from people. It gives you a sense of what people think. Some people think about this. And I think that it presents us an opportunity to tackle this head on. So this is the mindset of people. How would we sort that out? Do we need to open up and say, you know what, let's take you on a tour around some of these facilities and show you what people go through? I know there will be issues here and there, but we need to find a way to communicate this more to people, because with the figures we're seeing, these communication strategies don't seem to be working.
I'll take off from where something that Chamberlain mentioned earlier, that's the NOA. Whatever the NOA says now, I think there is a major challenge with communication, sincerely. I remember, NOA is a product of MAMSA in the 80s, in the government of Babangida. I'll go back there, you know, guys. I know you guys don't like me taking these history lessons, but MAMSA had a culture. MAMSA had a culture of in-your-face communication. You can't, once MAMSA brings out a message, it's in your face every day, every time.
Times have changed, Gary.
It's unfortunate that time has
I thought
changed
you wanted
so badly.
NOA to speak.
I wanted NOA, I don't want to hear NOA. I want NOA to communicate the implications of what we are grappling with to the people. Look at it. The source of infection of unknown exposure has increased from 74% to 77%. And from what Kayode has also said, people don't just seem to give a hoot. Go to the streets. Yesterday, and you know, we have referenced this, so let's just mention it again. We're getting into the cold season. The rains have come. Sore throats, cold, catarrh, they are symptoms of COVID-19, and they come with this weather. And people don't even seem to understand this. Where is NOA to communicate that to people in their faces? That's my challenge.
But it's a combination of factors, not just
I get that.
singular action or inaction
I
by
get
the
that.
NOA.
We don't seem to have, people don't seem to have a buy-in. And
Why
that's
is
a
that?
major challenge.
That's the thing.
Exactly.
They need to understand why and then address it.
We
It's
are
not just peculiar to
contending with
Nigeria
three.
anyway.
We are contending with three serious issues. It began with a health pandemic that has caused a serious health crisis on our hands, which led to a lockdown that invoked an economic crisis. And that's, so when we have had conversations here where people are saying, between health and hunger, which one do I choose? So that challenge is right there on the hands of people. And somebody needs to let people know that it's only people who are alive that can make money. We are not communicating this thing longer. Government is doing well. But maybe I will borrow the words of Mr. President. Their best is not good enough.
Oh, right.
Oh, okay.
I'm just borrowing those words. So if this is a serious challenge on our hands, and I also recall you referenced the issue of security, issues that we're having the other time. We're in the thick, when this whole pandemic thing broke, it was like nothing else was happening. No insecurity challenge, no other crisis, no political crisis, nothing. We seem to be going back to normal now. I think we have more serious challenges on our hands that we're giving ourselves attention to. Markwe.
Well, I feel your frustration, Ayo. I mean, it is extremely frustrating, but I disagree with you on communication. Perhaps you could be, that your explanation could provide answers in places that are rural. For instance, rural communities, we can ask, how effective has been the communication for the places that people do not really understand the Dogotorenchi that we're speaking at the PTF meetings? But when you also look at the attitudes of those who understand, or those who are around your bracket in terms of education, in terms of learning, in terms of status in society, who still decide to be careless, who do not see what the hula baloo is about. When you go to places where people are still crowding themselves, even in government quarters, oh yes, you have seen political meetings being held and you're saying, what is going on here? Why are people lumping together? They're wearing a mask, but they're holding themselves. And you're wondering, do they get the message at all? Are they aware of the risks? Of course they are. They're just for some reason, people are, maybe because we're social animals, on the one hand. On the other hand, people are just, doing things to be seen, to be doing things. And there are people who, when they're mandated, for instance, in an official environment, so in some offices, for instance, like where you and I work, it is mandatory for you to maintain social distancing. It is mandatory for you to wear a mask. But how many of your colleagues, sometimes when you're even having conversations with them, can you vouch for that actually uphold these, guidelines when they're out of the office? So it is a very, very tricky situation that we have found ourselves. There are people who knowingly, still realizing the dangers, but feel that, well, I'm not around the age group that can actually fall sick, or, I most likely will be asymptomatic, or I do not have any underlying health issues. After all, we have been told that 80% of those who will have this thing anyway will not show any symptoms. They won't even fall sick at all. The danger, and I think that's where, people who are asymptomatic really need, perhaps a little more education, or maybe we should open their heads and put this thing inside, is that you can be dangerous to a lot of other people. I keep listening to the news every day, and part of the reason, I'm quarreling right now, I'm not quarreling with anyone, but I'm not happy that, a particular demographic, which is quite young, which is the reason I am at home right now, pregnant women, for instance, are vulnerable. They don't have any underlying illnesses or anything of the sort. That's not what pregnancy is. But it makes them particularly susceptible to this particular virus. Just the other day in Imo State, a pregnant woman gave birth to twins. But she lost her life as a result of COVID-19 complications. Does anybody want to put their sisters, wives, mothers, and what have you in trouble as a result of the fact that they refuse, to imbibe some of these things, or just take extra precautions? I think the best we can do is keep talking. But I'm saying that right now, we need to move beyond talking. We need to move to institutionalizing enforcement, ensuring that people wear the mask. I remember the other day I was saying that the police in Ghana has been asked by the president to do this. And someone says to me, Maokwe, the police in Nigeria was asked to maintain interstate lockdown. How well did they maintain that? It's a big question. So if they did not maintain interstate lockdown, is it telling people to wear their masks that they're going to do, or how well are they going to do that as well? So we need to ask ourselves as a people, what do we really want for ourselves? Do we love ourselves enough to care about the person next door? Do we love ourselves enough to say, look, I might not be the one directly affected, but there are people whom this thing can actually affect. And for their sake, I'm going to, do what it is that I can. I'm not saying that government shouldn't up the ante in terms of communication. As I said, there are places where your explanation will be perfectly correct. But there are places that I have seen and I have heard, even while watching television, that I'm asking myself, do these people understand the implication of what we are saying at all? These are questions that we need to ask ourselves. As for security, now some people will say that they'll be very well justified when they say that, the things that plague us are a legion, so to speak. How can we be saying that, COVID-19 has killed less than 500 people in 3 months? But look at what the security situation is up north and see how people are afraid for their lives. 1 minute you're alive, the next minute some group of bandits can come to a village and 50 people are dead overnight, with absolutely nothing going on, unexplained, and that has been happening now almost on a monthly basis. How is it possible that a member of the Senate on the floor of the Senate says we are relying on soldiers from Niger, and there is no reaction on the part of our soldiers to that particular statement? They don't see it as an affront because someone's talking about the territory of Nigeria here. These things, have gone on for too long. And I think that we need to have a critical conversation with ourselves as to what Nigeria really means to us and what our next door neighbor, who our next door neighbor really means to us. Do we really love ourselves and our neighbor? These are the questions I have for us this morning, gentlemen.
Well, the thing is, you all have a point, because in social issues like this, there can't be that kind of categorical statements. We haven't gotten to the level or seen the kind of protests we've seen in different countries who just said, we are sick and tired of getting sick and tired about being locked down for COVID. They protested and hit the streets. Black Lives Matter happened, even in the midst of all of these things. So, but those areas, you see, there's a strategy that they have. they have a system. In UK, they protect the NHS. In the state, they look at the health system, the structure that they protect certain things. There's a system vis-a-vis the strategy, the messaging. So yes, they need to get message design experts to take a look at how things are evolving. Okay, look at the messages coming through from WHO. Today, they tell you, well, if you're asymptomatic, well, certain things can happen. And then we revised our policy saying, well, you don't need to test twice, negative twice for you to be discharged. So all of those messaging, you have to factor it in. How do people internalize those kind of messages when you come up? So it's equally important. And then our health sector. I mean, you heard them say, look, the reason why we eased the lockdown was so that the economics can be taken care of. What data are we working with now to ensure that certain things are addressed? When you point out some of these strategies, what are we working with? Interstate lockdown, where, look, there are so many areas,
how
really.
do we address this matter?
We'll ask those who are involved.
Who know the implications?
Well, we'll ask those who are involved.
Enforcement.
Well, hopefully, as we progress and see what really, how do we focus on these things? Because, look, it is very, very serious matter. Looking at the projections and those figures, it's not going down, guys. But we'll take a look at what the dailies are talking about this morning. Let's start with the Guardian newspaper today. And it did start where we started off today as well. The big lead, front page of the Guardian. Your best, not good enough. Buhari chides service chiefs. And did you say it's about time? Okay, well, look at the riders now. Others, fresh strategy. If they have fresh strategy, don't you think they would have deployed it a long time ago? And can people give what they don't have?
Well, maybe that's why it's fresh.
Okay.
fresh, the instruction or the strategy?
The strategy. So it's
he's ordering fresh strategy.
What a role is the national security
advisor? The National Security Advisor?
Yes, there was this document they published.
Oh, right. Last year.
Document?
Yes.
The National Security Strategy.
National Security Strategy. What role is that one playing in this matter?
Well, we'll find out. Look at the second rider. Opposition party, CSOs, condemn arrest of Katsina protesters. So you see all of these dynamics. That's why you talk about measuring certain things. And, well, I'll let that be as the rider indicates. And then APC crisis persists as court makes Gyadom acting chairman. So yesterday, the lawyers went back and forth on this one. How could he have come from where? And then, so now you have this one. Saliu dissociates self from new court orders. Ajimobi inaugurates panel on Edo primary. Leaders throng PDP secretariat to receive Obaseki. Governor, others shun recall to APC. So politicking still going on, COVID notwithstanding. And speaking about COVID, they also have something here. But I think some of the other dailies will highlight that COVID-19 cases deaths may rise until August. Experts warn. And this is what? June, July. Oof. And then you can see the back page for yourself, guys. Local league players are not poor, says SN1. It's about how you manage your income. Okay, that's Guardian this morning.
Well, let's take a look at the Vanguard newspaper for you. Buhari to service chiefs. Your best, not enough on security. Justify your appointment, he says. NSA decries lack of synergy among security heads. You see, that comes up again. Warns he won't accept any further escalation of insecurity. But then there's a statement from Defense Headquarters saying military, not weak, has capacity to tackle terrorism, banditry. And so you wonder, so what's happening? Where's the missing link? What is missing here? Well, more details on page 8 of the Vanguard this morning. I know we can go on and on about this, but what we want is clear. We want to solve these insecurity issues. But you know what? In Lagos, there was flood yesterday. A lot of people are looking at the skies, hoping it wouldn't rain as much as it did today. So that's a picture on the front page of the Vanguard. Flood in Lagos, and you see the Lagos-Abeokuta Expressway heavily flooded following persistent rainfall in Lagos yesterday. There's COVID-19, there's other issues now, flooding. More on that you find in the pages of the Vanguard this morning. But right under the big picture, you see Buhari's silence on APC crisis frustrating. That statement is credited to the DGPGF. That's right, on page 7. And there's this one, trying to clear the air, I guess. No plan to take over discos. Federal government. It's on page 8.
Okay.
Yeah.
Hope they can go to bed now.
I hope we can have more lights too. So, right on top of the nameplate, there's an update on the Edo elections and politicking, you might say. How PDP okayed Obaseki moves primary to June the 23rd. I mean, there's a whole lot of riders. Wike Tambuwal lists demands at talks with PDP leaders. You wonder what those demands are. Why Obaseki wants to run with Shaibo. More details on page 5. But finally, let me just show you something on the back page, that sports page. Onazi turns hero in Italy, not because he scored a goal or something. He caught a thief. More details in sports pages. And Igalo, most positive surprise that's coming from Schmeichel. We'll leave it there for the Vanguard this morning.
The Daily Trust newspaper leads with the same story about security. No more excuses. Buhari warns service chiefs. And there's a recommendation right under. Remove them, experts say. Why we are yet to defeat bandits? Well, if you read the story on page 5, maybe you will be as convinced as the military why we are yet to defeat the bandits. And of course, right above that one, expect more COVID-19 deaths. That's from the federal government. That story is on page 3. Find out more how shoemaking transformed lives in Jos, and a number of other stories. Man bags 10 years for defiling 10-year-old girl. Oh my. It's a lot of activity around, gender-based violence. That a number of people are trying to wake up consciousness about that. So many other stories I'm sure you'll find on the inside pages of the Daily Trust newspaper this morning.
Well, let's quickly look at Leadership Friday for you. APC at the crossroads as court declares Gadom acting chair. Ajimobi-led NWC consolidates, inaugurates primary election appeal committees. Progressive governors DG seeks PMB's intervention. Crisis, handiwork of our enemies, that's according to Uzodimma. I'll beat COVID-19 to be back on my feet. That's from Ajimobi. Don't forget that just yesterday evening, there were heavy rumors that he had passed, and they had to come out to say, no, he is still very much alive. Thank God for that. But looking at the other stories there, PDP shift primaries as Obaseki joins party today. That's also on the front page as well. You can still do better. PMB tells security chiefs, that's how they choose to couch it, as troops kill 52 bandits. Well, look at all the stories there. Airlines can't resume flights June 21. And COVID-19 CBN plans non-interest loans for anchor borrowers. Others at the bottom there. Let's see if we can find a story or two for you. PMB APC hails the governor and says he emphasizes party loyalty. Okay, and then that's story also there. Nigeria's.
Oh, sorry about that, which seems to have lost mark right there. But take a look at Nigerian Tribune next. They also lead with that lead story of politics. Court renews Giadom's claim to APC chairmanship. It is the big one for them, and you can see the riders. But the picture you see there, Ajimobi not dead. Family aid say. So there you go. And then look at this one. Right above this lead story. Rapists will be hanged in Kaduna, says El Rufai. Well, that's what you see here. So there you go. That is, they also have sports on the back page. Nigerian Tribune there. Social restates faith in Igalo. Way to go.
Well, let's quickly take a look at the Daily Times for you. Buhari goes tough on security chiefs. I mean, as you'll expect. Expresses anger over rising insecurity in the nation, tasks them to justify their continuous stay in office, orders NSA to meet with Northwest, Northeast governors. So yeah, Daily Times also reflects that story as its lead. You find more details on page 2. And yes, there's a reference to, sexual violence as Enugu CSOs want full implementation of VAP law. Yes, the states yet to domesticate the violence against persons prohibition law. So Enugu CSOs are also calling for that. You see some other stories. Kebbi tests 504 persons, records 6 deaths, 67 positive cases. as regarding COVID-19, as well as other stories on the front page of the Daily Times this morning.
All right, so there you go. That is it. We'll look at some of the dailies we've got for you today. But do stay with us. We've got an equally important matter to sink our teeth into in just a moment. Welcome back. Yes, indeed. We're taking a look at the health sector. We've got Dr. Julian Ojebo, who is the first vice president of the Nigerian Association of Resident Doctors, joining us from our studios in Abuja. Good morning, and thank you for joining us today. Well, yes, NERD still at this matter. So could you give us the latest perspective now? Where are we in this concerning the strike now? What is the recent position?
Good morning, Chamberlain. Today is the 5th day of our total indefinite action that we embarked upon. Throughout yesterday, we had several talks with both the Ministry of Health. We also had meetings with the chairman of the Nigerian Governors Forum to also tell him about the problems that we have that have been bedeviling the health sector in relations to the state tertiary health institutions. We made it clear that most of our demands are not about remunerations. Most of our demands about the dilapidated health system. We talked about the rots in the health system. We talk about personal protective equipment that are not available in our state tertiary health institutions. We also did talk about the infrastructural decay in our state tertiary health institutions, and these problems have been a recurring decimal, and we had quite an elaborate discussion with the chairman and also with the governor of Oyo State also in attendance. Where we are now is still at the level of promises, still having those promises, and we're hoping that in no distant time, these promises will really materialize into something that is tangible enough for us to use and get back to work as quick as possible.
Yeah, when you say you're still at the level of promises, what specific promises have been made?
Yeah, so far so good. We hear from the Minister of Health that personal protective equipment have been disbursed to most chief medical directors, but most of our members in those institutions have not reported back to us that they are in receipt of the personal protective equipment. Also, the promises still, we've always been on the front line of that. Our members have been dying from various health-related diseases, most especially COVID-19. 10 of our members have died, and nothing has been done with regards to the life insurance for these our members. Over 800 of our members have been exposed to COVID-19, 200 tested positive. So at this moment, we really don't have any paperwork to prove, to show that all they have been saying that the life insurances have been completed, we've still not seen them yet. So until we see these paperwork that they are real, they are legit, then we know that we're making some progress. Also, with regards to the medical residency training funding, we don't have anything concrete at this very moment to say that works are on top speed to make sure that these the template for the medical residency training has been instituted. So it's still at the level of promise because we don't have anything tangible to say, okay, these and these have what have been done so far. So we're still hoping and waiting that very soon we would get all that we deserve and we desire.
When some of those demands that you've highlighted, for instance, the health sector, these are not things that can be addressed immediately in a month or two. Some of these things will take a while, given the processes that they have to go through. So how is NERD expecting the authorities to respond to some of those particular issues?
Thank you, Chamberlain. Every negotiation has a template. If there is a template on the table, we can now say, okay, this is the template we're using, because we're not unaware of government tactics to delay. 2014, we did have a memorandum of terms of settlement for arrears that were owed to our doctors, written from 2014, 2015, and 2016. There was a memorandum of terms of settlement, but this has not been actualized. Okay, government has reneged on their decision that they actually also did make. Now also, the government also did say across board to all health workers that we're going to pay the hazard COVID inducement allowances. These hazard COVID inducement allowances, only 11 centers have gotten them. At the point they said they had paid, they had not paid. So we keep getting this high level of insincerity and non-committal from executive appointees. So this has been the major dilemma that we've always had in the health sector. When they say a word, they don't keep to their promises. So this time, we really want something concrete that we can say, fellow Nigerians, this is the promises they have made to us, and on our honor, we're calling off this, we're suspending this industrial action for another time, but we really don't have them at this very time. So we need some form of framework, some form of template. When we're discussing with the state tertiary health institutions, we want some form of template. We don't just want promises like, I'll do this, I'll do that. We're used to, I will do this, but we've not gotten them at this very time. So that's what we are still insisting, that we want to sit down to iron out these gray areas so that they will be made crystal clear that these are the decisions that have been reached following the negotiations.
I thought that there was a sit-down between the association and the Minister of Health recently, which he highlighted yesterday. Was there?
There was a sit-down, but we don't have anything pen to paper. All we just have are just word promises. So we want them to be on pen and paper such that we can say, okay, this was the agreement that was reached. Until we have something concrete, until we have something tangible, we don't think there's an end in sight to the industrial disharmony.
Is it concrete when he also did say concerning the PPEs that the states have received those and then they were supposed to now act based on that?
Sorry, I didn't get that.
He also did talk about state governors, the states having received some PPEs. What information do you have on that?
Okay, like yesterday we have a discourse with the governor of Oyo State, His Excellency Seyi Makinde, and he did tell us about his plans, about the distribution of PPEs and then the equipment of most of the isolation treatment centers for COVID. He only told us. We have contacted our residents in those centers, and they've not been giving us that very positive figures that we need. We want these personal protective equipment in abundance because we are currently in the community transfer for COVID, and we keep using these personal protective equipment. So we need them in their numbers. If we don't have them in their numbers, it's going to be a difficult thing. Like somebody did say yesterday to the hearing of the governor that we as health workers, we haven't even seen these N95 masks. We don't even know how they look like. We only see them on TV. We only see them on executive appointees. We use the standard surgical face masks. So if we're saying that these personal protective equipment have been provided in abundance, then we know that they have been provided. Our members will get back to us and tell us that they are in abundance and we have them at this very time. So, but for now, we do not have them. We do not have that feedback from our members at the state level. So once we do have that feedback from our members at the state level, we now know that, oh, okay, there's some form of progress. So we can now say the promises that have been made can actually be sustained. So that is where we are currently.
Could you put some numbers to some of these things? Well, when you say you want feedback from the states, do you expect the governors to all respond in the same way, or is there a percentage of those equipments that you expect to receive to meet a certain percentage of the doctors in those states? Shed some light on that.
We have 36 states in this country. If 10 of our members are calling back and saying that the disbursed personal protective equipment had gotten to us, that's some form of committal to our own course. So we now know that, oh, they have actually now moved from the process of promises to actualization of these promises. Then we can now say the other ones that are on the way, we can now say we can suspend our action after meeting with our National Executive Committee and present to them that these 10 states or these 11 states have sent, and we have confirmed that they do have them in these centers. So after that, then the National Executive Council will now say, oh, because of these commitment level, we can now say, let's suspend our total indefinite strike for the time being, and giving the other governors some time to also replicate them in their own centers. Also, this applies to the federal government. If we get to see the templates for the medical resident training funding, if we get to see the templates for the life insurances for our members, if we get to see the templates for payment of our 2014, 2015, 2016 salary areas, then we now know that, oh, for sure, there is a template, and we can now move forward and say, let's give the government time to implement this template that they have given. There should be some form of committal from the government before we can now say, oh, for sure, these and these have been done. But at this very moment, we don't have that level of commitment. So we're looking at the level of commitment and our promises and our demands to say these and these have been snowballed into action. But on this very issue, nothing is done at the moment. Now, take a look at the hazard inducement allowance they said they paid. They paid to 11 centers.
Okay. Well,
out of the 36 states of the Federation.
Doctor,
so this
just
gives
one
you
moment.
some form of worry.
Add the rest of your thoughts. Add to the rest of your thoughts your response to this question. It would seem like you want intervention from the federal government on the one hand and the states on the other hand, because you've talked about pockets of states now. You've talked about the PPEs and a number of other things. Are these requests from the Federal Ministry of Health or the state ministries of health? Because, I mean, we have heard your interface with the federal government authorities, but we just hear pockets of conversations that you are having with one state governor or the other. What kind of intervention are you having at the state's levels? Are you speaking, are your members, your executives at the state level speaking with the governors individually, or it's something that you are taking on together?
Yeah, all around the country, our members, our national executive members, that are presidents and the other executive members in the individual local chapters have been given the mandate to interface with their individual governors. We decided as the national body to interface with the chairman of the National Governors Forum. We know he's just the first among his equals, but he still has a vantage point to making home these demands to the erring governors. Take, for example, in the issue of Kaduna State, where His Excellency Malam Nasir El-Rufai single-handedly reduced the salaries of health workers across the state by 25%. So we've made our plea known to the His Excellency Governor Fayemi that at this critical time, this is not necessary. Our members are going to work on the daily. Our members are being exposed on the daily. And you're now cutting their salaries by 25%. Mind you, this is not 25% of the total 100% salary. Kaduna State government pays 62.5% of the agreed salaries of the revised comments of 2019.
Yeah,
They're
but
paying
Dr. Julian,
62.5%. Now
Kaduna
you've
State
taken a
government.
quarter of 62.5%.
Okay, but Kaduna State government, the
that's
last time
real-
we spoke with them, they said it wasn't unilateral, that they had put up a message and then there was communication, but the NARD doctors there who are employees of the state government, they wanted everyone across board, but the impression was that the doctors wanted something differently. So to that extent, can you still say it was unilateral?
Sorry, can you say that again?
Kaduna State government's communication is that it wasn't unilateral, that they did involve all of those who were concerned, not just the state's doctors employed by the state.
Yeah, it was across board. All the health workers, all health workers.
Okay.
But they interface. The point is they interface, the government interfaced with those health workers before that action was taken. Also, we also remember that the Kaduna State government also said that they gave some specific concessions to health workers. They give them some form of allowances as a result of the risky job that they're doing. Isn't that, satisfactory on its own?
That's not true. That's not true. The governor of Kaduna State is a beneficiary of the good work that the doctors of Kaduna State are doing. He never interfaced with the doctors in Kaduna State. He never interfaced with them. So if you didn't interface with someone, how then do you go into his salary and take part of his salary? He never interfaced with our doctors. And now he's saying that he has. Is that not ironical? You say you have special packages for doctors and health workers, and yet you single-handedly remove 25% of the 62.5% you've been paying them.
Okay, well, we'll see how they respond to that. But speaking about which, when you spoke about some monies that have not been paid, the communication from the Ministry of Labor is that he says that the federal government has paid $2 billion to health workers across board in 14 teaching hospitals and the FMC. This was what he said as at Monday. And then he went on to say that there are about 43 of 52 teaching hospitals and the FMC, and that by Wednesday, $4 billion would have been paid out for this purpose.
Chamberlain, again, this government, executive appointees of this government have been shifting the goalpost. You're aware that he did say that he had paid these monies 2 weeks ago. He also did come on TV and said he had paid on Monday. We were in the meeting with him and he told us that he had paid the previous night. And these were all not true. As we speak to you, information we have at our disposal is that they've only paid 11 centers. 11. That's the information we have as at 12 midnight of yesterday. Just 11 centers. So I don't know what the 14 centers, because those other additional 3 centers have not told us anything. So we don't know where those 3 centers are.
I'm sure you've been following the trend. I mean, COVID-19, the figures keep rising. We just recorded 745. We're in the community phase of transmission. You also, you referenced that earlier on. And to be honest, we don't know what the future holds when it comes to our health system, the management of COVID-19. Now we have this strike to grapple with. And I mean, you say it's indefinite. The question is, how far are you willing to go?
As a sign of good faith to the public, and because of the intervention of the Honorable Speaker of the House of Representatives, Right Honorable Femi Gbajabiamila, and the Chairman, House Committee on Health Services, Dr. Tanko Sununu, we did convey to our members the need for us to make sure that every of our treatment isolation centers all across the country is covered. Now, we've done that to make sure that members of the NARD and other staff of the hospital are in unison in the treatment of these Nigerians in these various centers. So we have made calls, and we are sure, we're 100% sure that all these centers are well covered. So we don't have any problem with the coverage of the isolation treatment centers. Now, what we did say was that we're giving a caveat of 2 weeks. Okay, within 2 weeks, if we don't get any tangible declaration, as it were, from the government, then we are going to be having the need to reconvene another National Executive Council meeting to discuss withdrawal of our members from those treatment isolation centers. But at this very time, we do have all our treatment centers properly covered. All the doctors ranging from different level of specialty, from medicine to laboratory medicine, are all covering these various hospitals. So we do have them covered.
You know
so
that
we do not have
COVID-19
any fear with the response to the treatment in these centers.
Right. You know, COVID-19 is just a part of the whole. There are other ailments that people will go to the hospital naturally just to get some form of care or treatment. So aside COVID-19, that seems covered. And I'm sure you recall during the stages of COVID-19, there were reports that, patients were being turned away. A lot of people, didn't get care because of the fear of COVID-19, basically saying that there are other ailments right now aside COVID-19. So yes, you say COVID-19 is covered, but there are other ailments. We have people telling us that they can't get access to care as at now across the different health centers in the country. So the question still is, how far are you willing to go with that?
The Medical and Dental Consultants Association of Nigeria did instruct the members to make sure that they cover various emergency points. Using case in study where I work, Euro Specialist Teaching Hospital, the accident and emergency is being covered by medical and dental consultants. So the consultants are there to take care of very dire emergencies and also the patients that are still in the ward. Remember, we work, our training is some form of specialist training. We work under these consultants, and now these consultants are still there delivering services to the people of Nigeria. Most of the accident and emergency centers are being covered by the consultants in the various departments. So we're not so familiar with the term people are being turned back and they're not being taken care of. I don't think any consultant is turning back any patient. They're really taking care of them, and we hope.
Excuse me for jumping in. We want to just put in two things.
From this media,
we want to put in two things before we go. First is that
will be done, and then we can achieve what we want to achieve.
All right. There's so many people who are wondering that, look, as it is now, with the COVID-19 figures just going up on a regular basis, they wonder, why are the doctors choosing this time, knowing that the healthcare sector could be overwhelmed? Why not a little later after this COVID?
Chamberlain, like I said, our demands have been for the past 20, 30 years. You heard the former Minister of Health, Professor Chukwu Onyebuchi, did say that everything Nigerian doctors have gotten over time, they did get from industrial actions. So why do we need to wait for doctors to embark on an industrial action before there's some form of negotiations? We've been meeting. Our president, Dr. Aliyu Sokomba, has been fantastic. He's been coming to meet these people on the daily, and then we don't get any some form of committal. So why do they wait till the doctors are fed up? Why do we have to wait till that time?
Okay.
Now, we're even talking about
also add to this, Dr. Ojebo.
Working at this
Just
time.
one moment. Just very, very quickly, that point is noted. But are you also aware of the Trade Dispute Act Section 43 that says that where any worker takes part in a strike, he shall not be entitled to any wages or other remuneration for the period of the strike? That's what the Minister of Health has also said. Are you aware of that? And how do you respond?
We're aware of the tactics by executive appointees of government to withhold compensation or salaries due workers, people in the labor sector. However, I want to say that the Minister of Labor is not being owed any salary. The Minister of Health is not being owed any salary. If they were being owed, they would have protested. We've seen in this country where members of the National Assembly have had curse to say, give us what you owe us.
Okay, so we get your point, but we need to go.
Doctors are being paid.
All right, we get that point. What's the time for the next meeting? Has anything been scheduled? Just quickly, please.
we have a meeting today. They'll be calling us very soon.
All right. Thank you very much, Idin, and we wish you all the best. We hope this is sorted as soon as possible so that everyone can get back to what we do. So thank you for talking to us today, Dr. Ojebo. We're back in a moment. Stay with us. Welcome back. Well, yes, indeed, we're joined by the Minister of Health, Dr. Osage Hainire. Good morning, and thank you for joining us today on the program. Well, it's something that the country wants to get a solution to. Well, first, we're starting off with the situation with the doctors' strike. What is the latest position?
Well, the latest position is exactly as the young doctor just described, Dr. Ojebo, that they are withdrawing services and creating scarcity of service, or those services at our general hospitals. We are beginning to worry about the consequences of 8,400 doctors leaving the system at this very critical time. Not that Nigeria had one of the strongest health systems in the world, but the advent of the coronavirus disease has obviously increased the strain on the health system. And that's not only in Nigeria. You look at all other countries, exactly the same thing, even up to the United States. Russia, if you look at international news, which I know you do, you will see that various countries have suffered a huge pressure on their health system. The UK, Spain, Brazil, all countries are suffering, not only the strain, but also the shortages. There are shortages of materials and personal protective equipment, even masks. There are some major countries that had a tussle over 200,000 masks not long ago. So we are going through a very difficult time, along with other countries. And quite clearly, this is the worst time for someone to add more to our problems by deciding to go on strike. And compounding our problem, I worry that we are probably the first, perhaps the only country in the world where doctors choose such a difficult time to withdraw their service, whereas in other countries, doctors, nurses, those who are, even if they have retired, are all returning to work to help because they know that their country, their people have a problem. There is an emergency, and this emergency is everybody's problem. It is not just the government alone. It's everybody that's supposed to put all hands on deck. And some people are taking their hands off the deck.
Now, your meeting with the doctors, I mean, yes, we all want to see a solution, you know, as highlighted previously. But it appears it didn't come out well, or did it, because they just say there wasn't any pen put to paper. What happened in the meeting? Did it go well from your perspective?
Well, the young doctors, the resident doctors, popped in at my office yesterday unannounced. I didn't know they were coming, but I immediately stopped everything I had on my program and met with them. We had a meeting in which I repeated just what I'm saying now, that we are in the unenviable position of being globally the first and only country where the doctors are going on strike. And that this was not good for our image and also not good for the results we have. Now, we are not yet at the peak of the coronavirus problem. And if you are going to take your hands off the plow at this time, then we are going to have issues which will be seriously embarrassing for us as a country. We have a case fatality rate now of about 3 or less in some places. We are worried that this case fatality rate will increase, and also the withdrawal of service for other services, other ailments, which we are already worrying about. Maternal mortality, we are not doing well. Infant mortality, under 5 mortality, we are not doing well any of these ones. So the worst thing we want to see now is that our indices begin to rise even further. I told them all of this, and I also assured them that their grievances will be looked into. Some of these grievances date back from 2014, that is 6 years ago. And you choose this time of the year to bring it up. The meeting I had with them yesterday was actually the very first one-on-one I had with them, because they hadn't been to the ministry to have this chat. And when they came in, the directors were there to also talk to them and try and counsel them. Now, they left without saying anything, and I was under the impression that they had understood and they were going to at least show some empathy and begin to consider calling off the strike and going back to work in the interests of the citizens and those who are in the hospital languishing. But I haven't heard from them since then. I do not know what decision they have taken. But from the conversation I just heard just now you had with the vice president of the association, it looks as if they're still holding the same stance.
Well, the challenges Nigeria's health sector is facing notwithstanding, I mean, everybody wants it to be sorted. But it does appear as though there is a communication problem and that government has a huge role to play. I mean, put simply, the ball is in government's court. The doctors don't seem to have the confidence from the government. They think that government says one thing, and then they look at it, their word, they're not putting their money where their mouth is. So they say one thing, but what they see in reality is different. So how do you expect them to actually go with those kind of circumstances?
The Speaker of the House spoke with them and reassured them. The chairmen of various health committees in the House spoke with them, reassured them. The Minister of Labour has spoken with them. I have spoken with them. I think all these voices are enough from both the legislative arm and the executive arm. We've tried to persuade them that we are in a tough situation and trust us, we'll take care of you. I am a doctor too. I went through residency for very many years. I know what it's like. But I will have a very serious guilty conscience if I were to choose a moment of weakness to start launching an initiative of this sort, which will definitely not be pleasant for some people in the country. So the issue has to do with some trust. You can't have trust in your government, particularly this government. We have made it clear that this government is the most serious and the most sincere government that this country has ever had. So its word is its bond. You know that this government made a promise to pay pension arrears that were long overdue. Remember the Nigeria Airways pension arrears which were long overdue, had been carried from one regime to the other. It is this regime that paid it. And the same for those who had worked, I think, the police men who had worked in the Biafra era. This government paid it. So this government has a record of being sympathetic to people, of meeting its obligations, and also of keeping to its promise.
It will seem like that trust is greatly degraded, has been greatly degraded over the years. Well, you're talking about this government, but from one of the things that you heard Dr. Ojebo said, some of these problems are age-long, some of them running into decades. You know, this government just came into power in 2015 and up until now still in power, but there are people working with this government in the civil service who have understood these problems, and they have been part of several agreements put to paper that have not been done, nothing has been done about them. That's why the doctors would say that government will agree to something, but they will not make good on their promises. So is there a system to ensure that the agreements that are reached with these doctors are actually executed and that the doctors can then have confidence in government that indeed not only you, the minister, but all the people in the Ministry of Health will ensure that whatever promise is made is fulfilled?
Well, it's difficult to convince someone if they are determined not to be convinced. Over the years, the people in the Ministry of Health are not the same. They have changed. The government has also changed. And I just told you now that this government does things differently. This is a government that meets its word, makes a promise, and actually meets it. So that's enough backing. Also, the ministers have changed, the directors have changed, the permanent secretaries have changed, and they are all giving their word and their promise. And we're all doctors. We know what you feel like. And we will not do anything to hurt you. We work in your interest. So it's difficult to give any other form of assurance. And I would also say that There are probably a lot of assurances that have been given and fulfilled, and not all. Some of them are contentious. There are some that are in court. As a matter of fact, some of the ones about 2014 is in court, and we can't decide on those subjects while they're still in court. And there are other demands that the federal government cannot itself directly attend to if there is a particular issue between one state and the doctors working in that state, and you want the federal government to be able to solve that problem for you. Well, we shall try to put in a word, but we cannot guarantee that we can provide you the answer. That's an issue between the doctors of that state and the government of that state. Now, the National Association cannot hold the entire country, the rest of the country, responsible for what happened in one state.
I mean, talking about trust and still on what the government, this current administration can do, for the resident doctors, I mean, you talk about trust, but for them, they say seeing is believing in terms of the personal protective gears. They say once they get it, then they can say, yes, we trust you. In terms of hazard allowance also, they're saying it has taken months. This has been in the works, but not all of them have received. In fact, just a little percentage of these doctors have received. So in terms of the trust, how hard is it to put this trust into action such that they see it and they say, yes, indeed, you mean what you say?
A few days ago, we had a long discussion that took probably 8 hours of negotiating at the Ministry of Labor, in which the ministers were trying to persuade them that this allowance is being paid. At that time, it had not been paid, and they wanted evidence. And they said that if it would have been paid, if one person had received an alert, then that will indicate to them that it was going on. And although evidence was shown that the money had actually been paid out of the Ministry of Finance, it has to go through a system from TSC accounting to a commercial bank account. That takes some time, it takes perhaps some hours, and they wanted to have evidence that if a few people could claim that they had seen an alert, then they will be convinced that it was going on. Now, in a moment, they will say that 11 institutions have seen that alert, so it tells you that it's going on. What else do you need to build trust? So now the 11 states are no longer enough, or rather 11 centers are no longer enough. The rest is coming on. We did mention the other days when they will be paid according to the timetable set up by the Ministry of Finance, and also the mechanisms involved. I'm convinced that this money will be paid, and you can take the word of the government for that.
Right. So, I mean, they, on the other hand, will say, okay, maybe we'll just wait till all the monies are paid. But you know what we all want is for the doctors to come back so we don't have a bigger crisis on our hands. And I mean, you mentioned that you went through residency, and just hypothetically speaking, if you were faced with these challenges, I mean, inadequate PPEs, as they have said, the issue of hazard allowance, you know, the medical residency training framework, which they want to be put in force, medical health insurance also. If you were faced with these challenges, what would you do?
Well, let me tell you what I will do. In the first place, I have already said earlier on that these are not challenges that are unique to Nigeria. In other countries, if you can recall, if you looked on television, the UK had to start going to look for PPEs from Turkey, and because they had run out, and people were improvising. They were trying to use garbage lining, garbage barrel lining. Same thing in Spain. They understand that this is a difficult situation for everyone, and everybody must contribute. Everybody must take the brunt of it. So they try to use different things to improvise, to cover themselves, and to create their own masks and reuse masks. In fact, the WHO had to come up with guidelines for reusing face masks because there was a global shortage. Now, we don't manufacture, we have to buy, we have to procure, and we are doing quite a good job on that because I personally put a lot of emphasis on it and make sure that we have a stockpile, and the stockpile will be able to meet the demand of any place where there's a sudden shortage, where there's a sudden rise in use. Of course, we are pleading for judicious use of this equipment, if you use this equipment carefully and cleverly, because we don't manufacture and they're quite expensive. And we still promise that we will, in fact, we are going to take delivery of some equipment and PPEs tomorrow, Saturday, which is coming into Abuja tomorrow. It's already arrived in Lagos. So we are making sure that we provide all these equipment. Now you ask me what I will do. I will also think, I also think of the patients. I also think of the others who are suffering, who are languishing, people who can't breathe, people who are running to the hospital and finding no doctor, women who want to deliver and they're in labor, there's nobody there to attend to them, and immunizations that are due and they can't be given. So I will also think about that, and I will say, okay, good, let me go back to this job, and then I'll go and fight for my rights later on. And that's what I'm pleading with them, in that they have chosen a very difficult time at the moment when they have a position of strength, and it looks like the people they bargain with are not really need them badly. But in reality, it's a country that needs us doctors very badly, all of us. And I can see a situation where even doctors who have hung up their stethoscope will come back and say, look, we can't wait and let people die. Let us come and see how we can help. And that's what I expect these young doctors to do.
All right, but Dr. Hane, well, the chairman, PTF, on COVID-19 was quoted copiously saying he didn't know the health sector was this bad. And having identified it, what is being done? What is the plan for the health sector?
Well, let me say generally that what COVID-19 has done is that it has shown that no health system was that strong. The health system in the UK, in Spain, even in the US, as we are seeing now, all these health systems were brought on their knees because of the sheer volume that this disease throws up. And no health system was ready for it. And I don't know any health system that really could cope with it. You know that the Chinese had to start rushing up 1,000-bed hospitals within a number of days because what they had on ground was just not enough. So it's not quite fair to be bashing the Nigerian health system. We know that it's not good, it's not very strong, but you can't be bashing this system against the coronavirus disease because it's taught the whole world a completely different lesson. Now, we're using the lessons learned to reshape the health sector.
Not that we're bashing the health system, Honorable Minister. My apologies to jump in. Not that we're bashing it. We're saying haven't identified the challenge, because those other countries, they saw the challenge. It took them unawares, but they've ramped up efforts ever since then, and they're doing something about it based on data. So what are we doing about ours? Haven't identified this problem. That's what I'm asking.
Yeah, that's what I'm answering also, in that you are going to, as I told you, we are getting supplies again tomorrow coming in by air. We are doing everything to bring in supplies, to import supplies from everywhere. We are bringing in these hazard allowance. I mean, not all countries are even paying hazard allowance, mind you, but it's something that we already initiated on our own even before anyone asked for it. And I've spoken with doctors in other countries who said there's nothing like that. That's your job anyway. So we are bringing that in, and as an additional incentive, and also the life insurance, which is coming in, and the various other initiatives to ensure that our health workers are safe. But the changes we are talking about are not changes that you are going to see overnight. In the first place, we have to deal with this situation, the situation we are in. How do we take care of people who are sick? How do we anticipate how many people are going to be sick? How do we make sure we have all the supplies? How do we make sure we have the bed space, the personnel, the doctors? How do we use what we have most efficiently and most judiciously so that it will last us? Now, at the same time, we're looking at what do we do about our health system. We're already building isolation centers all over the country, which we hadn't in the past thought of. We are beginning to build ICUs. We are piling up ventilators, and we are discovering right now that in fact what we need are oxygen generators. We are going to start placing more orders and more emphasis on oxygen generators. So the health system is responding in its own quiet way into these challenges. And there are things happening, I can assure you of that. And also the primary health care at that level is swinging into action. We are going into case finding and surveillance and community-based management of cases. There are many things that are coming up and things we are learning, not only here, but also learning from other countries, learning from the mistakes that other countries made, and also from the victories that they have had.
Let's quickly touch on, COVID-19 figures, what we're seeing now. Yesterday, we recorded the highest daily cases so far, 745 now. At this stage, 4 months into our COVID-19 battle, we're really hoping that we'll start, dipping and hopefully get this under control. But it seems that is not happening. And I know you have a vantage position. Earlier on, while moving into this phase, you said our decisions will be guided by data and science. When you look at the data, what is happening?
Well, when you look at the data, what is happening is what is happening in nearly all countries in the world, in that you have a high rise, and eventually everyone is trying to flatten the curve. We are also using data and science and hoping that you reach that plateau and then begin to see the dip. But what countries are also worrying about is the case fatality. Out of all the cases you are getting, how many are you able to treat successfully? How many are you losing? And what tactics do you want to employ to make sure you minimize your losses? So those are all things which we are looking at very carefully. Yesterday in my speech, I decided that I will focus on giving particular attention to the vulnerable group, those who statistics and data show the majority among the fatalities. And those are the ones with pre-existing ailments and those who have who are above 50 years old, and that they must have particular attention. They must be the ones that we urge most to stay at home and to go out only when it's absolutely necessary, to wear a mask and to avoid crowds and to avoid crowded areas, to walk in the market very deliberately. In fact, not to go to the market unless it's absolutely necessary. The same with social gatherings, even religious gatherings, because they are vulnerable. So if we can protect this vulnerable group, we can reduce the fatalities, we can minimize the fatalities. So that's the way we are adapting to various lessons we learn along the way. And the cases rise because we're in the phase of community transmission, but we are also successful in curing many of the cases that arise and saving the lives of those that will have been lost. And we do not want this strike to add to the sadness that will befall our country.
Lastly, these figures rising are definitely giving everyone concern. And one of the issues that people have talked about over and over again is how we coin our communication in a way that people can own it. Yes, we have departments of people who know the implications and don't just seem to care. But then we are more concerned about those who may not be getting the message of the information we are putting out right. How concerned are you about this? And what is the ministry or the committee doing about it, the task force doing about it?
Yes, you are correct. The message is extremely important. There is no public health situation where messaging has been as important as this one. And you can see from the experience of various countries that if they didn't get the messaging right, they made a lot of errors. Here, the Ministry of Information has been doing a great job working with the National Orientation Agency to generate jingles. Center for Disease Control is doing the same thing, Ministry of Health, and all those who are involved, and a lot of volunteers too. I've seen a lot of foundations and NGOs that are involved in trying to generate the right information and try to have a good penetration of this information. And that this information should particularly reach those who it is supposed to reach, the vulnerable. And then the others who will carry this virus and themselves not feel any symptoms. There are people who have no symptoms, but they will carry that and persuade such people to agree to go into observation. We don't want to use the word isolation anymore for the period for which they are infectious and then to be released when they are no longer infectious. So the messaging is strong out there: washing of hands, social distancing, or the things we call the non-pharmaceutical interventions. We are emphasizing, translating to various languages, and trying to reach penetration down to the grassroots, and also looking for people to show good example. If you showing good example for those who respect you and look up to you, they will definitely emulate what you are doing. And we also tell people that you wear a mask, you wear a mask. I'm in my home right now, sitting here, and I don't need a mask. But once I leave here, I wear a mask, and when I'm talking to you, I make sure my mask is covering my mouth and my nose. You still find people who take down their mask when they want to talk, which is exactly the opposite of what the mask is supposed to do. It's supposed to catch the emissions coming out of your mouth or out of your breath as you speak. So we use every opportunity, like this very one now, to educate the public on the non-pharmaceutical interventions that can save lives.
All right, so we're all in this, so we'll have to all do what we can to ensure that we save ourselves, help our country to help us. But we do thank you for talking to us today, Dr. Osagie Ehanire, Minister of Health. And all the best to yourself and the team.
Thank you very much. Thank you for your questions, and I hope you help us spread the message out there and let people understand that this is not just a fight for the government, it's a fight for all of us. All people are involved, citizens and professionals, all of us are in there.
We'll absolutely do what we can to help our country. Well, back in a moment. Join us again. Welcome back. Well, turning our attention to politics now. Ismail Ahmed joins us now. He is SSA to the President and also a member of the BOT of APC. Thank you for joining us today on the program. Well, yesterday when many thought they'll try and digest what had happened, and then it hit them again. The court extending the tenure of Mr. Giedom, and then people just thought, oh dear, not again. How is I guess it doesn't rain for the party now, it pours. This is a huge challenge at the moment, and the way it's playing out, I can't say you're surprised, are you?
No, I'm not surprised, Chamberlain. I am embarrassed. I'm embarrassed by the way the people that we have saddled with the responsibility of running a political party have messed it up to this level. This party this year is only 6 years in existence, and 5 of which we have been in government. Nigerians have done their own part. They have given us an overwhelming majority in all the tiers of government, from the federal level, National Assembly, to almost most of the state governments that we have won in 2015 and a repeat of it in 2019. But in 5 short years, or in 6 short years in its entirety, we the younger people who have contributed our sweat and our little time and resources that we have on our own side to help in building this party. And you would remember, this channel especially would remember the role that all of us as young people play, and that we are still playing. Some of our foot soldiers are still out there in the social media giving their own best part to build a structure that will outlast or outlive us. But yet we have saddled responsibility to people who are former this, former that, who have come and have bastardized this institution that was built with well-intentions and the sweat and hard resources of so many people that have come to the table to build this party in 5 short years. So no, I'm not surprised. I'm absolutely embarrassed with what is going on. And everybody now goes to court suing the party or being sued by the party on these issues, claiming the constitution of the party. And yet most of the solutions to our perennial problems are yet found in this constitution that is observed more in breach than in compliance. So I'm absolutely embarrassed. Now we have a problem in this country. The problem is a lethal combination of a health crisis and a security crisis. And yet, we have a political party that Nigerians have entrusted with the ability, with the responsibility to run the affairs, and yet we are focusing on who is doing what and what is doing this and who is going to court, who is the chairman of the party, who is this, who is that. We have all failed, myself included. You know, we have all failed. Even the younger people, we have come together, we want to speak with one voice. We're holding a press conference. We're going to write letters to all the caucuses of the party, be it at the National Assembly, the president, the vice president, national leaders of the party, NEC, Governors Forum, what have you. What we are going to say to them in no uncertain terms is that we have all failed and we need to make a change of course immediately. We have an 8-year mandate of the first tranche. We have 3 years to go. And yet we have a lethal combination of a security and a health crisis, and we're focusing on pettiness that is bringing down the structure that has brought us into government. It's an absolute embarrassment.
So you sound like you're disappointed in the whole leadership structure. For you, are you taking sides and saying, well, the challenge came from this person or this group of persons? How is it working for you? Are you disappointed across board or in specific, organs of the party?
I'm disappointed across board, and I said myself inclusive. I'm a member of the Board of Trustees of the party, the Board of Trustees that has never been inaugurated. And yet, if you look into the constitution of the party, a lot of issues ought to have been ratified by the Board of Trustees. And yet, it has never been inaugurated. Yes, we have been appointed into those positions, but we have never been inaugurated. And look at, the party is supposed to have convention every 2 years. That's the operative word. Every 2 years, we are supposed to have a convention to ratify most of these issues. Have we done that? No. We are supposed to be having NEC meetings once in every quarter. Have we done that? We have had only NEC meetings twice in 2 years. So what are we doing, really? So I'm not blaming this or that, the whole gamut of leadership of the party, we have failed. And we, the young people who are always playing supporters club. And I told them we had a meeting yesterday. We're going to have another meeting today. We're going to be having a lot of meetings with a lot of young people who are stakeholders, who I have known have played a critical role in bringing this party as well, in playing their own role. We're all going to be having meetings throughout this weekend. We're going to meet our leaders and other stakeholders to tell them that, look, we cannot allow this to go on. So you cannot come because you have jumped the queue. Because you are former this and former that. And then you try to destroy the structure that we have helped build together, because tomorrow you feel you can jump into another party and jump in front of the queue because you can claim you are former this, you are former that, or current this or current that. We do not have the latitude or the luxury of being former this or former that. But if you think that you can destroy this political structure and we will watch you, and you can jump to another ship tomorrow when you feel that you have destroyed this, and go and jump in front of the queue and get whatever you want, because to you it's just a vehicle, it's just a platform, then you are mistaken. We are here, we are going to salvage this party, and everybody is going to do it again, together. We are going to call on all the leadership of the party. NEC meetings must be called. We must address these issues. So I'm not disappointed in one person or two people. I'm disappointed in the whole gamut of leadership, and myself included.
You said a couple of times here, you said that you're disappointed in someone jumping the queue, or people jumping the queue. Who are you talking about specifically?
A lot of people. Everybody knows what happens. A lot of people jump the queue. So, for example, take Edo, for example. Everybody is shouting today that there's a problem between the Godwin Obaseki and the national chairman, Adams Oshomali. I'm not from Edo, but I've heard from people will tell you that, Obaseki was brought in from nowhere. He jumped the queue. He was given governorship. Now they have a problem. And then they brought in somebody that they just swapped from PDP who ran against us, at the last election in PDP. And now, too, he's getting the ticket probably, or there's a consensus. He's also jumping the queue because he's what? Former this, former that. And then Obaseki now will go back to the other political party, maybe PDP or another political party, while there are other people that have labored for that party who also jump the queue because he's what? Because he's a current governor. And before you know it, the whole thing to them is just a platform to get what they want. Now, I don't have a problem. Everybody can go to wherever he wants because it's a constitutional right to realize his ambitions. But we built this party on an intention of an institutionalized structure to bring change to Nigerians. Nigerians have done their own part by voting us into office. We have not reciprocated in even building a lasting legacy, an institution that people will be proud of. Basic things, call for meetings, we can't call for basic meetings because of pettiness and self-ego and whatever it is that's going on. We can't allow that to go on. If nobody is going to talk with the voice of reason, we will have to. Because we are ultimately either the beneficiaries or the losers of whatever it is that this do. In the next 5, 10, 12, 15 years, most of these people that are parading themselves as leaders today will not be in the field again.
Okay, so let's talk about the leadership of your party.
Whether for good or for rot.
Right, so let's talk about the leadership of your party. You've talked about candidacy, but regarding leadership, because there's also a major issue around leadership of your party, is this whole jumping the queue scenario you painted, is it also applicable when it comes to the leadership of your party? Is that also irking you?
Yes, when you have a situation where people who are holding political offices, who are holding party positions, who are being nominated by governors because they were loyal to them, or by a certain structure because they are loyal to them, not because they have been loyal to the party, not because they have contributed in doing anything. Because to them, go to a lot of states, you see, for example, I'll give you a simple example. Go to a lot of states, you see in some states a legal advisor who is not a lawyer, you know, a youth leader who is not a youth. In fact, I heard, I don't know how true it is, that there's a woman leader who is a man. They just say it's a position because the Constitution did not define whether that the woman leader should be a woman. You know, because to them, it is just about holding that position so that the person becomes a delegate and he does their bidding when it is time for election. There are so many things that are wrong. And this Constitution has provided a way that we can do. We have issues with this Constitution. I personally have issues with some of the provisions of this Constitution. But that's not the case we're at right now. As it is, if it is fully complied with, most of these issues would not arise. From the first time we've started having problems, when some people took the party to court and took Adams Oshomole to court, for example, when the court suspended whatever it is, the motion or order they got, we had time, absolute time, to call for a NEC meeting, ratify a lot of decisions, call for a mini convention, ratify a lot of decisions, and move on so that it can stand on legal footing, you know, on a strong structure. But we didn't do that. Now, I have simple suggestions, for example. Like I said, we're going to have meetings with young stakeholders of the party. We're going to have a press conference. We're going to write letters to the caucuses of the party. Simple things. We should be having meetings. There should be mandatory meetings every 6 months that every person who is a member of this party, no matter how highly placed, will go to his ward and attend a mandatory meeting once in every 6 months. So, for example, just imagine President Muhammadu Buhari going to Sarkin Yare A ward in Daura local government in Katsina State to have meetings twice every year. And he will be face-to-face with party members at ward level. Or Adams Oshomole going to his ward every 6 months to have meetings. Do you think that the ward would have constituted itself and suspend him from the party if they see him on a regular basis? You know? Or all of us, the Senate, the President of the Senate, the Speaker, ministers, governors, everybody should be having a meeting with his ward level. Because this party belongs to the people, it does not belong to the leaders. The leaders were supposed to provide direction. But even that is beginning to look very, very doubtful if that is going to be done. But we're not going to allow this party to fail. Nobody is going to allow, we are not going to allow this party to fail. So things must be done. There should be a NEC meeting. There should be a mini convention once the protocols of NCDC or this coronavirus ends, God willing. And then we should have, as soon as possible, have these things. NEC meetings can be held via Zoom. It should be held, and these things should be dealt with. And then we allow the people who are in governance focus on the job of governing this country, dealing with the health crisis and the insecurity situation.
Let's just get a legal perspective on some of these things going on and see the possibility. Mr. Fred Nzako joins us as a legal practitioner. Good morning and thank you for joining us. Well, you know, there are those who are looking at all of these issues as they are playing out, and then they say, well, the court's playing a role I don't know what adjectives, different adjectives to describe the role that the courts are playing. But from members who may just be wondering, these cases, from your perspective, do you think that they are cases that can quickly be resolved, or some of them could linger up until, who knows, 2023?
In the first instance, nobody should blame the court for playing a role. The courts have responsibilities to play a role of stabilization, a role of righting the wrongs, a role of attending to issues that are contentious, a role of coming to the safety of any institution or individual whose rights are being wronged or trampled upon. The court is there to attend to everybody. It is not only the leaders or the followers, everybody. And then if anybody does not approach the court does not give rulings or give orders. The court has to be first approached with issues before the court is activated. So it is not really the fault of the court to have activated what it has activated. But the natural thing that we should always ask is that after 21 years of civil democratic rule, have we not learned any lessons at all? Are we playing politics of development or politics of destruction of the conscience of the people? For how long will politicians continue to rub mud on the faces of the court to their best interest and against the welfare of the people? These are issues and questions that should be asked, so that we begin to play politics of development and ensure that our country moves from the morass that it is experiencing today. Because what is going on and playing out in APC is a democratic morass, is jaundice democracy. This is not democracy that we all yearned for in 1999. What we ask for is a democracy of development, a democracy that will bring everybody on board and move the country forward. And more so when APC has pledged to Nigerian people that it will bring the needed change that they yearn for in 2015. That change is not coming. Today, all we see is crisis. And such crisis has not allowed the party at the central level and even at the various states to deliver dividends of democracy that they were voted for. So we have to ask some relevant questions and demand answers. I have listened to my good friend over there and about his lamentations. These are genuine lamentations. And then by extension, it is not only limited to APC, these are lamentations of the polity, which we need to clean up. There is every need for a clean-up of the Nigerian political space to ensure that democracy takes a firm root towards the development of the country.
All right, Mr. Fred, just give us a moment. We'll return and then get both of you to give us your concluding thoughts in a moment. Do stay with us. Welcome back. Well, Ms. Nzako, could you just tell us in conclusion, I mean, from your professional perspective, do you see these cases being resolved sooner, or it will be there for a while?
Well, the cases are not likely to be resolved sooner because there's a valid and subsisting judgment of a competent court, which has handed over the chairmanship of the party to Victor Giadom for the next 2 weeks. And I do not think that there was a stay of execution of that order. So the order subsists. And APC, as an institution, as a political party, is bound to obey any valid order of court. This is a valid order of court. And then until the next 2 weeks, the resolution can only be political. And that is calling Victor Giadom to a round table and sitting him down to tutor him on the tenets and the issues relating to the party constitution. And if he says no or becomes recalcitrant, there's virtually little or nothing the party can do. The only court that can vanquish that is the Court of Appeal, because the court of the FCT High Court that gave that order has become functus officio. It can no longer validate the order by itself. That order can only be set aside by the Court of Appeal. And the Court of Appeal is not only there for APC and at their beck and call. They have loads and loads of assignments and timetable that this will not even be easily be accommodated. And I can tell you that it is not a matter of urgent national importance, such that it can very easily sway the Court of Appeal to adjudicate immediately. So
All
the
right,
only
then.
option that is left for FTC is to take political solution to their problems and challenges.
Okay, thank you very much indeed for your thoughts, Fred Nzako, legal practitioner. Well, let's get back to Ismail and get his concluding thoughts. Well, you have talked about how you need to sort all of this out so that all the formers will not make the political party be referred to as a former political party. How do you, there are those who think that, look, as it stands now, this may likely cost the party the forthcoming elections in Edo. And with this court judgment now, giving Gyadom putting him in the saddle, how are you going to approach all of this? What's your thinking about the way to go with this?
I have mentioned it, you know. We have to have just practical, political, commonsensical solutions to this. You know, I understand sometimes politics can be petty. I understand it can be personal. I understand it can be local. But we will not allow pettiness and local thinking and self-aggrandizement and egoistical, whatever it is that these people have, destroy an institution that we hope to inherit. You know, and they can take their former this and former that and take it to wherever it is that they want to go to. But we have not been former this and former that. You know, we want to be current to this, we have 20, 30 years ahead, God willing, in this game. And we want to be able to build a structure that we'll be very, very proud of. And so there has to be a commonsensical solutions to this. And they are very simple. I don't want to go into the legal arguments or whether this is right or this is
wrong. Let that go then.
I don't want to get into that legal argument. I am simply saying there should be a NEC meeting. It should be called immediately. Okay. That should be done immediately for every decision that has been taken in the interim to be either ratified or rejected. There should be a national convention, which is even constitutional, that should be done. And then we have 12 million members, and then the Constitution says that every 6 months there should be update of members. And then we can't just keep going on like that. So my simple conclusion is there must be a NEC meeting, and at some point there must be convention, and these issues must be tabled. Nothing should be swept under the carpet, and let's deal with it and move on.
Thank you very much indeed, Ismail Ahmed, member of the BOT of the APC. Well, just before we go, we still have time for one more thing. Okay, all right. So, that's but even myself, I was a bit shocked myself. Yeah. Okay, well, that's the show today. We thank you all. We'll see you tomorrow. I'm Chamberlain Uso.
I'm Kaido Kikele.
I'm Ayo Makere. Have a wonderful weekend and please keep safe.
Exactly. Did Chamberlain just say tomorrow? I don't know what Sunrise Daily is happening tomorrow. I know about Sunrise, but maybe not the daily version. Thank you so much. I'm Malko Yusuf.